Good evening to everyone and welcome to today's session. Himasagar, Malakrishna and Rohan Yadav, Deepika and everybody. Can you please punch whether the voice is loud and clear for all of you? Yes, Doc. Yeah. Sorry, today I'm very late. We'll finish. Today I prepared more number of quiz questions. We will try to finish. We'll try to finish them, and after we finish the quiz, we will go ahead with the few more questions left over in the biochemistry for the today's session. So let's make the great beginning. Yeah, keep punching your answers, Dr. Ranjit, Sharmishta, Tony, and Sarah, etc., etc. The small intestinal electrical waves which are being shown in the figure, how are they basically generated? Who is the one which generates them is a very important question. For a better clarity for you, you can look at those which are being mentioned. These are the intestinal peristaltic waves that we are showing. We are talking about this, the electrical activity, the waves. So what is your opinion, doctor? Yeah. So Chandrakant, Haidar, Amrita, everyone is saying interstitial cells of Cajal. Now you have become the experts in the question bank. Very good. That is the way we should approach the entrance. We should not look at the question. Looking at the answers, we should be in a position to identify what the examiner is asking us based on the high yield topics revision. Very good. So most of you are right that it is interstitial cells of Cajal. So if you take the intestinal contractions and motility, there are the slow waves which are being generated, and it is the interstitial cells of the Cajal which are called as the pacemaker cells is what you need to remember. So if you look at the stomach, small intestine and colon, typically the waves generated in stomach will have this morphology. In the small intestine, this is the morphology called the slow waves, and the morphology in the colon, which you should be in a position to recognize and identify. Now, doc, a reflex is being shown to you. Yes. You tell me, what is this reflex? The steps in the reflex have been shown to you. When there is an exercise, there is a stimulation, and that leads to inhibition of the gamma motor neurons which are supplying the muscle spindle, and that decreases the muscle tone, leading to muscle weakness and stoppage of exercise. So what is this reflex basically called as? Question number 2. Punch your answers, doctor. So you should remember that let me check. Himasagar is proposing J reflex. Sharmishta, Roshan Yadav and Najneen, everybody is proposing J reflex. Absolutely. It is called the J reflex. Now, in the red box, this is the EEG. In the red box, what are these waves that you are seeing in a normal person? When do you see this kind of waves which are being shown in this red box is the question to all of you. Yeah. Should your answer, doctor? Good to see 50 online students joining, and nowadays youtube.com/onlinembbs has become the favorite channel for self-preparation and a free coaching. So I'm happy to see all of you, and I hope you'll bring many more of your friends to join this super 1000 batch of the NEET PG. Now we should call it as next exam, right? So what is your answer, doctor? So Pratik Srivastava is proposing REM. Ranjit Shaw also is proposing REM. And very good. Most of you are absolutely right. Very good. Today, a lot of correct answers. Arshad Musa is clean bowl, but most of you are right. No worries. Arshad is going to go back to the online MBBS video library and do a revision. Now, doc, you identify the hormone which typically has this kind of fluctuations in its level during exercise and sleep. So, which is the one which rises during that time? Which one is it? Question number 4. Hima Sagar and Cricket Guru Pratik Srivastava, everyone is proposing A, that is a growth hormone. Growth hormone. Absolutely right. Very good, doctor. As the exam is nearing, I think you're all geared up very well, and I'm able to see a lot of correct answers today. I'm so happy. Of course, I'm also happy when you go wrong also. Yeah. Now, doc, this is the typical volume pressure curve during the inspiration and expiration. Now, the examiner's question is, why there is a difference in the trajectory between the inspiratory and expiratory loop in this curve is an important question. Yeah, should you answer, doc? So why there is a difference in the trajectory between the two? Yes. So Himasagar says it is the difference in the surfactant. And Sharmista Singh and Sunandini is also thinking it is the difference in the surfactant. Absolutely right, doctor. Absolutely right. Now, this is the typical action potential curve in a nerve. Narume. This is the nerve's action potential curve, AP curve. Now the question is, yeah. Now the question is, what is the difference? You have got a period and B period. You tell me, doctor, period A which is being shown, during that time there is no, another wave cannot be done. What is the reason for that? Question number 6. 6 बोलते ही हमारे पास 63 ऑनलाइन स्टूडेंट्स अवेलेबल हैं. वेरी गुड. सो आज 100 टच करना है. हम आज आपके लिए गर्मा गर्म हॉट इमेज बेस्ड एमसीक्यूज के साथ आज आए. ज़्यादा टाइम हम क्विज के ऊपर स्पेंड करेंगे बिकॉज exam is nearing and you are almost all experts, and we have an online mbbs.com video library where you always have the concepts whenever you want to go back and do the revision, right? So Sudha Shukla is saying, is betting on sodium channel. Pratik Srivastava, Pratik is also proposing sodium channel. Okay. What else? So Pratik is proposing sodium channel and closure of, I will read the option D for you. I think the chair is coming on the way. Yeah. Yeah. So option D is saying closure of inactive gates of sodium channel. Give an answer? Yes. So Sunandini is absolutely right. It is the closure of the inactive gates of the sodium channel is what you have to basically remember. Now, doc, it is the absolute refractory period. So there are two concepts: absolute refractory period, relative refractory period. Now you know very well. Now, Which is the vitamin which is required for this enzyme A is the examiner's question. Should you answer, doc? First, you look at this thing. Glycogen बन गया, glycogen 1 phosphate, glycogen 1 phosphate बन गया, glucose 6 phosphate, that becomes glucose. You all know very well. Now here you have an enzyme A, enzyme B, enzyme C in these three reactions. Now the examiner's question is, enzyme A के लिए what is the vitamin that you basically require is the examiner's question. Yes. So, question number 7. Himasagar says pyridoxal phosphate, Arghra Saha also, Roshan Yadav clean bowled, Vibhaji Kare, pyridoxal phosphate. I am so happy. अगर ये क्वेश्चन रॉन्ग करे तो मुझे हार्ट अटैक आ जाता, क्योंकि लास्ट 15 days, लास्ट 10 days we have been discussing biochemistry only. So you are also revising biochemistry. Before that 2 weeks we discussed pharmacology. So I don't want to see you pharmacology biochemistry में wrong नहीं आना answer, right? Very good, very good. So Bhuvaneshwar Bhaskar is also proposing A, absolutely, pyridoxal phosphate. So you should remember that pyridoxal phosphate, which is vitamin B6, it is the prosthetic group for the glycogen phosphorylase, is what you have to basically remember. Now doc, the structure of the DNA is being shown to you. देख रहे हैं ना structure of DNA? अभी आपको कुछ bonds है. कहाँ है bonds? Nucleotides, purines, pyrimidines के बीच में bonds दिख रहे हैं ना? हाँ, examiner simplest question is, what are these bonds between two nitrogenous bases is the examiner's question. So what is your answer, doc? Yes, what are these bonds between the nitrogenous bases? Arsad, Ranjit, Charumati, Subramani, everyone is proposing hydrogen bonds. Absolutely right. Now doc, this is a test done for 3 things. In the one, this is for proteins. This is for sugars, and this is the ketones. Now the examiner's question is, in a starvation state, what will be positive is a very important question. Question number 9. Should you answer, doc? During starvation, what will be positive? Good to see 80 online. हम बहुत खुश हैं. Please keep punching answers. I should see all 80's answers. That's good. So every day I will prepare 30 MCQs, hot MCQs, image based questions. हम discuss करेंगे ताकि you become fully active and energetic. And every Sunday grand test. Please don't miss the grand test. Grand test लेना है. 300 MCQs में कितने write कर रहे हैं देखना है. और whatever you are going wrong, wherever you are going feeble, you have to go back to the onlinembbs.com video library. Top NEET PG in 120 days is the program. So you should, you have all these videos of the high yield topics, MCQ based, theory based, everything. So please do the revision. So everyone is saying C, only 3, absolutely. The ketone bodies are only positive in starvation. अच्छा भाई, इसका आंसर करो, हम आपको गोल्ड मेडल दे देंगे. इतना इजी नहीं है. चारुमती से सर संडे ग्रैंड टेस्ट ऑन द ऐप. बाय ऐप में नहीं मिलेगा, बट इट इज अवेलेबल टू यू ऑन द onlinembbs.com on the website, because actual exam is a CBT, computer based test. So there is a reason it's always good to have a practice on that. And we are nowadays not, we are encouraging you to be part of the onlinembbs.com, right? So now doc, question number 10. This is a DNA repair mechanism which is being shown. इतना easy नहीं है इसका आंसर करना, right? So what you have here, there is a repair happening. अगर this particular repair mechanism अगर effect हुआ तो what is the repair mechanism used here which is affected? That you should be able to answer. If you know that, you will answer this. Any defect of this type of repair mechanism, it is a DNA repair mechanism. देखिए आपको a double stranded है, मगर it is a double stranded break which is being created and that is being repaired using the insertion, deletion and then addition of that filling gap. इसको क्या बोलते हैं? What do you like to call this as? Is a very, very important question. Yes, doc. So most of you clean bold, I know, because the only thing that we know in DNA is dipyrimidine dimers को repair करना, अगर repair में problem है तो xeroderma pigmentosum. So we will try to answer based upon what we know. But what we should know is, you should remember that the schematic was showing that the double-stranded breaks which are being created are repaired by non-homologous end joining. This is called non-homologous end joining. And non-homologous end joining type of a repair is the one which is having a defect in case of severe combined immunodeficiency. Is fundamentally because of what? Is because of non-homologous end joining repair mechanism में दिक्कत हो गया तो severe combined immune deficiency disorder आएगा. That's what you need to basically remember. So what are the other kinds of repair that you know? There is a base excision repair, nucleotide excision repair. That is the place where you are having xeroderma pigmentosum, where nucleotide dimers are being repaired in xeroderma pigmentosum. So ये तो वेदांत के बाद उपनिषद है बायोकेमिस्ट्री में. So no worries, suppose examiner gives such a kind of a question, if you answered it wrong, टेंशन की बात नहीं है, because आम आदमी रॉन्ग कर रहे हैं, सारे क्लासमेट्स रॉन्ग कर रहे हैं, so it's a nothing to worry. But if you take a 300 marks paper, remember 250 questions are perfectly predictable if you have revised 950 high-yield topics and the videos that we made available in the onlinemmbbs.com revision करके almost 20,000 MCQs का discussion सुन के एग्जाम गए तो 250 स्केटिंग कर सकते. 50 क्वेश्चन भगवान के हाथ में छोड़ो, राइट? हाँ. So Roshan Yadav is proposing long chain fatty acids. Very good. And Arga Saha already got it. What is this condition called as, doctor? It is called as, please remember, hepatorenal-cerebral syndrome of Zellweger. Zellweger is what you need to remember. Where the problem is there in the handling of the long chain fatty acids, very long chain fatty acids. What are very long chain fatty acids called? Very long chain fatty acids, VLCFA के अंदर problem है. That is what you need to remember. Very good. Now doc, the following test which is being shown in this infant, where do you basically do that? So this is the test. Newborn baby, the moment he came into this world, he is thinking, भाई NEET होगा या next होगा, मैं next लिखना या NEET लिखना, नहीं तो running race लगा के मुझे सीट दे देगा. So he is thinking about it. Life is very tough, doctor, right? So sometimes I feel हमको seat कैसे मिला? At least those days, about 19 years or 20 years back, it was relatively easier. So आजकल तो परेशान कर रहे हैं, हर एक साल एक नया स्कीम आ रहे हैं, right? ऑल इंडिया जाके नीट जाके नेक्स्ट जाके और क्या आएगा मालूम नहीं, हाँ? So don't worry about all those things. Ultimately एग्जाम तो रहेगा, नॉलेज तो रहना है, and application of the knowledge you have to be good with, right, doc? So now Sara Kadari is proposing inborn errors of metabolism, and most of you are absolutely right, doctor. It is called as a dried blood drop. It is called dried blood drop is the one which you need to remember, which is done for inborn errors of metabolism. The patient is having bilateral proptosis. He is being investigated and it is being identified and a biopsy is being done. Now tell me, doc, what are you able to see in this biopsy in a proptotic child, proptotic patient? So good to see 90 online students. Badhiya. Another 10 students को लाओ. हम आप सबको ई चाय पिलाएंगे, राइट? ई कॉफी, राइट? साउथ इंडिया फिल्टर कॉफी पिलाएंगे, राइट? सो अर्घा साहा इज प्रपोजिंग सी. हर्षित गौड़ा बराबर बोल रहे हैं, एंटोनी बॉडीज. Absolutely right, doctor. So you should remember it is schwannoma. Most of you, Madhu, where are you clean bowled, Madhu? You thought it as rhabdomyosarcoma. Achha, because of the proptosis, eh? Oh, slight miss, no problem, right? But histology wise, you should look for. Even rhabdomyosarcoma also lead to proptosis. That's what we should remember. Now, doc, this following peripheral smear which you are able to see, बेटा अर्जुन, आपको क्या दिख रहा है? इसमें क्या दिख रहा है? इसको क्या कहते हैं? What are these called as? And these are all seen in all these conditions except question number 14. Yes, doc. Give one confident answer. Shilpa is saying, sir, blood cells को tears हो रहा है, tears हो रहा है, right? Very good. They are called teardrop cells. They are found in all these conditions except what? Give an answer, doctor. Shilpa proposes C, and Shanmati proposes D, and Vishalakshi is proposing C. Badhiya. So if there is any problem in that, what you get is called as teardrop cells, and let me choose the pen color. Okay, yes. Now, doc, why do you get, the correct answer is C, absolutely. So why do we get teardrop cells? Whenever there is any myelofibrosis, myelofibrosis का मीनिंग क्या है? बोन मैरो में you are having the erythropoietic cells. So there is a lot of fibrosis in that. It is unable to produce blood cells anymore. So when the bone marrow is unable to produce, then who will produce? Liver will produce. Similarly, spleen will produce. So when liver or spleen is producing, what is that condition called? Extramedullary hematopoiesis. So when the extramedullary hematopoiesis is happening, the liver is like a stepmother. Bone marrow is like amma, love of mother, the purest form of love. So इसको बाइकॉन्केव डिस्क बना के रिलीज करने के लिए टाइम रहता. बोन मैरो अगर हेमेटोपोइसिस कर रहे तो, अगर लिवर इफ इट इज डूइंग hematopoiesis, it is like the stepmother. So the little girl Sita going to school. If it is mother, what she will say? Beta Sita, तेरा हेयर सेट कर रहा हूँ, अच्छा टिफिन बॉक्स में क्या क्या है बताएगा और खाओ बोल के बोलेगा. स्टेप मदर क्या करेगा? She will give a slap and say, get out, time for going to school. So liver, which is the extramedullary hematopoietic site, is like that. It doesn't have time, it doesn't have taste, it doesn't have energy, it doesn't have patience to create a biconcave disc. इसलिए जब सीता स्कूल को निकलती है क्या आएगा? टीयर्स आएगा. So teardrop cells are a sign of extramedullary hematopoiesis, which typically happens in myelodysplastic syndrome, myelofibrosis and myelothesis. Myelothesis का मतलब क्या होता है? There are metastases happening into the bone marrow. When the bone marrow is flooded with a lot of metastasis, then the bone marrow is not having any ability to do erythropoiesis. So that kind of an anemia, which is due to the metastasis destroying the erythropoietic tissue, is called as myelothesic anemia, is what you have to basically remember. Right, very good. So that is the story, doctor. Now this is also called dacryocyte. Dacryo का मतलब क्या है? It is crying, right? So now let's take up the question number 15. This is the patient. This is the patient. You are able to see his fingers, nails, and there is a endoscopy. He is also having dysphagia. She is having dysphagia. So what is your answer, doctor? So Pratik, Deepika, Suraj, they are all proposing except TIBC. Obviously, it is a case of Plummer-Vinson syndrome. Absolutely. Sesha Gopalan perfectly bataya. So yesterday Sesha Gopalan said that, sir, video rakho. So we honored that point. At least quiz part rakh diya. So all these image-based quizzes that we have, doc, we will try to retain it. We will try to retain it, and we will try to remove the core discussion of the topics, so that our intention is you will come back and then have a subscription in the onlinembbs.com and try to do the revision there. So that's the reason we try to remove that. So please feel free to buy a subscription. I know that classes are evening classes, we have a free time, but for you to do a good revision, take the online mock test and then see how good you are progressing. And the 120-day program is like according to a calendar. Day 1 about 8 to 10 topics, day 2 8 to 10 topics, like that. So आपको personal discipline आना है. The whole purpose of coaching is to get a personal discipline, motivation to prepare for the entrance, right? So let's make the great beginning. Question number 15, most of you are saying B, absolutely. Iron deficiency may TIBC is elevated is what you need to remember. So what is the combination, doc? You have Plummer-Vinson syndrome, and Plummer-Vinson में आपको रहेगा, yeah, I need to change the slide color, yeah. Plummer-Vinson में आपको रहेगा dysphagia, iron deficiency, esophageal webs is what you need to remember. No, doc. Absolutely. Rajit Shaw is also saying the same. A depressed patient came with the history of sudden onset of dyspnea. Chest X-ray shows bilateral diffuse infiltrates, predominant involvement of right middle and lower lobes. He could not be saved despite treatment, and an autopsy, the lungs appeared normal grossly, and the histopathology has been shown to you. दिल लगा के देखो हिस्टोपैथोलॉजी में आपको क्या दिख रहा है. So based on that, What is your diagnosis is the examiner's question. Yes, doc. Should your very good, 95, another 5 more students. So please put this YouTube channel link in all the social media that you are the member. There are so many Telegram groups and there are so many WhatsApp groups, Facebook groups, etc. etc. To even offer a free treatment or a free coaching also, doctor, you need to do branding. We don't have money for advertising. Always we say our own students are our brand ambassadors. Because last 20 years there are thousands of students who took coaching. We don't boast very big way. Because I always consider when the students get a top rank, it is their own effort, a good effort. Maybe I did 1 or 2 cents of work to inspire them. That's the only credit that we can take. But it is you. And once more, what the formula that worked for you may not work for your brother. But generally, a lot of students, I could get an opportunity to inspire them or contribute a little bit to their concepts. So that is the reason, doctor, you are our brand ambassador. Now, yes. So you should remember it is B. Absolutely. Most of you are B. It is a vegetative matter aspiration pneumonia. Einstein's equation is asking, sir, where are these things are uploaded? So Einstein, please give a call to our helpline number and they'll be more than happy. Einstein equation is our paid student. So please call the helpline and they will tell you what is the folder in which they got uploaded. Right, doc. Now, let's take up the next question. What is the origin of the hematological condition whose peripheral smear is being shown to you? This is a very important clue. You have done a peripheral smear, elderly person, gone for a routine checkup, no symptoms, at most he may have infection, and the peripheral smear has shown this. So, first of all, what is this condition? What are these cells in the peripheral smear called as? Right? What are these cells in the peripheral smear are called as? So, very good. 98 online students. 2 more chahiye humko. 2 aa gaya to call your friends. Right? 100. Then I'll take a screenshot as a memory. Right? So, we used to have in October, November, 400-500 students attending online, live. बहुत मजा आया last year. So the same feeling we should have. Excellent. Ranjit Shah, Vishalakshi, or Bob, 105. I need to take a quick photo of this so that it will remain as a memory. Super duper, doctor. Thank you all for bringing a lot of new students with 103 century. We made a century, right? So every day we should make double century, triple century and enjoy a good learning evening and get activated for preparation. Very good, doctor. Now, these are called smudge cells. Smudge cells are those fragile CLL lymphocytes. When you are preparing the smear, they become broken down. So typically a feature of CLL. So let me check what are the, how many, very good, Sesha Gopalan is our mass mover. So he is going to bring a lorry full of medical students. Abhi, very good, very good. So now the question is, yeah. So doc, the CLL originates from naive B cells in interfollicular zone. This one important topic, doctor. Leukemia, lymphoma may you should not do wrong. Sudha was clean bold, but no worries. Sudha Shukla is absolutely good. Very good. Very good. Now, A 14-year-old boy, right eye proptosis and upward displacement of the globe. A firm mass was palpable in the inferior part of the right orbit. So which investigation will help you in arriving at the diagnosis of chloroma is a very important question. So this is the proptosis, and on biopsy you found a chloroma? Yes. So where do you typically see which investigation will help you to arrive at the diagnosis? Excellent. Ritu Raj is proposing peripheral smear. Peripheral smear. Then Vishalakshi thinks peripheral. Arga Saha also. Excellent. And Abdul Sabur is saying, sir, you are doing a great job. Definitely. You guys tell that you will come every day and bring a lot of your friends. हम अक्टूबर सितंबर में मिडनाइट मसाला प्रोग्राम भी चलाएंगे. Night 12 o'clock to morning 3 o'clock we will have a 3 hours of a non-stop review of MCQs. Right? So as the exam is nearing, we can do a lot because morning is a little, patients will call and lot of disturbances will be there. We as medical students are quite often nocturnal creatures, right? So that time we will try to spend more time in discussing. Last moment में हम critical questions बोल के एक session conduct करेंगे अक्टूबर नवंबर दिसंबर में. Only critical questions which you must need to do the revision. So 100 questions रोज हम review करेंगे. But what I am telling you is please enroll into our paid program also, whatever the fee that you can pay, so that once you join a paid subscription, that helps us to run this organization, which is a challenge. A lot of people, their salaries need to be paid, multimedia guys and so many things, right? So let us, so it is a peripheral smear. Now, in a hilly area, male patient presented with fever and splenomegaly. Sudha is also saying, sir, we will go in a war footing in an exam fever the moment that October, November, December comes. Very good, very good. Right. So, Harshit Gowda is asking the link for paying the fee. Kindly give a call to the helpline and they will give you the admission, right? Whatever the fee you can pay, no worries. What is affordable for you, right? Now, your question number 19. Ritu is proposing erythropoietin estimation. Absolutely right. So, आपको ये peripheral smear में क्या दिख रहा है? What you are able to see? These are metamyelocytes, doctor. So, these are the metamyelocytes. Metamyelocytes, along with a high TLC count and the hemoglobin being 16, points the diagnosis towards polycythemia rubra is what you have to basically remember. Now, doc, yes, a 30-year-old male patient. Now, before that, I forgot to ask you a question. Okay, you have done erythropoietin estimation. What will become the erythropoietin if it is polycythemia rubra? Will EPO elevate or will EPO decrease? Will EPO elevate or EPO will be decreased in case of the polycythemia rubra? Satya Snigdha Tripathi asked a very interesting question. Sir, why not JAK mutation? By JAK mutation karne ke pehle, what is the protocol? You have to decide whether it is a primary polycythemia, which is the problem in the bone marrow, a myeloproliferative condition. Since he comes from a hilly area, you want to know whether it is a secondary polycythemia. So how can you differentiate the two? If you do EPO, erythropoietin, if it is secondary polycythemia, it is elevated. If it is a primary polycythemia, it is decreased. So that is the first investigation. That's what you need to remember. Gotcha? That's good. That's good. So, 30-year-old male patient, severe dyspnea. mitral stenosis, LA hypertrophy, vegetations on mitral valve, and you have done the excision and histology is being shown to you. Chavai, what is your answer for that? Right. So, Satya Snigdha, I always, Satya Snigdha is our most proactive student. अच्छा comments लिखते हैं lecture सुनने के बाद. So, under the video you have a PowerPoint, under the PowerPoint you have a comment section. So into that you can upload your own handwritten notes also in the onlinembbs.com video library. So please do that so that we get a lot of inputs from you. While you are listening lecture, always you can make a quick note and you can be able to click it up. So Harshit Gowda says rheumatic fever and it is the Ashkoff nodule. Absolutely right. Now doc, there is a drug that has been shown to you. दिल लगा के सोचो. The drug is acting on transglycolases and there is a failure of cross linkage in the bacterial cell wall, and that is how its antibacterial action is dependent. So which is that typical antibiotics mechanism of action? What is the drug A is the question to all of you. Good. Very happy to see 111 online students. Very good doc. So in view of our century, crossing the century, we will try to retain this video in the youtube.com channel for today. Yeah. So Ranjit Shaw proposes B, vancomycin. Most of you are absolutely right, vancomycin. Now doc, vancomycin is considered to be the drug of last resort. And typically it acts on D-ala end of the peptide. It forms a cap over the end of the chain and it blocks the cross-linking is what you have to basically remember. So it inhibits the PG bole to peptidoglycan biosynthesis on the bacterial cell wall is what you need to remember. अच्छा भाई, यहाँ next question में जरा story बहुत लंबा है. A morbidly obese diabetic woman was on a failed metformin therapy. She has the history of pancreatitis, family history of bladder cancer, and don't want to take injections. So she was given a diabetic drug, and उस diabetic drug का mechanism of action दिखाई दे रहा है. So what do you see here? This drug A is acting on SGLT2 receptor and inhibiting the SGLT2 so that the proximal tubular reabsorption of the glucose is inhibited. So there is a glucosuria which will occur because of that, glucosuria. So now the question comes, which is the drug that has this kind of a mechanism of action, right? Mechanism of action. So Harshit Gowda is saying teraglutide is implicated in cancer, and Soma Varapu, Sunandini, clean bowled, Sita Gliptin answer करे तो Rama Gliptin will be unhappy. So Sita नहीं है, कौन है जिसका mechanism of action ये है, Gliptins का mechanism क्या है? So there is doctor, please don't forget, before some of you have recently come up, but 3 weeks in this kind of evening sessions, 3 weeks we have discussed 1100 MCQs in the past 15 years of All India entrance exam, divided into 50 topics. We have discussed that, and this 6 to 8 classes में पूरा concepts को we have uploaded into the top NEET PG in 120 days program on the onlinembbs.com. So pharmacology is one subject, doctor, you have to be obsessively sure, because This is one topic, one area, highly scoring subject. So if you have done this question wrong, please go back to the video library and do the revision of diabetic drugs, which is the favorite topic of the examiner, right? So it is canagliflozin. Most of you are absolutely right. Canagliflozin is the one which you need to remember. So how does canagliflozin work? The filtered glucose is reabsorbed in the proximal convoluted tubule. So that is the one. The SGLT1, SGLT2 are the ones which are responsible. So this is the one which blocks the SGLT2 transporters. Canagliflozin is what you have to remember. Excellent. Now the next question, जरा ध्यान से आंसर करना इसको. Yes. Very good. Now, an unknown drug is being tested in an experimental setup. The results are obtained and made available here. The drug is causing an increase of the heart rate. It is causing the tremors. It is increasing the systolic BP and it is decreasing the diastolic BP. मतलब vasodilation, total peripheral resistance is coming down. Tremors भी हो रहा है, heart rate भी बढ़ रहा है. So what is the most likely possibility that drug could be is a very important question. Harshit Gowda is our opening batsman for this question. Answer A बोल रहा है. Very good. And Madhushri thinks alpha 1 and beta 1 agonist. Alpha 1 vasoconstriction है ना बेटा? Madhu, you can't do this question wrong after attending our pharmacology session. Alpha 1 अगर stimulant है तो agonist है तो vasoconstriction होता है ना बेटे. So vasoconstriction हो गया तो आपका diastolic BP गिरेगा नहीं. So it should be perfectly vasodilatory. So Samsung is proposing B, okay, and Mala Krishna is proposing B. Mala Krishna is proposing B. Navya, Jindabad. Yeah. I mean, हम तो थोड़ा will pull your leg. So don't worry. The purpose of the teacher is to pull the leg, Madhu. So no worries. So you need to do the revision and you need to keep applying in the MCQ context. Very good. So you're right. Beta 1, beta 2 agonist is a drug. Beta 1 is typically there in the heart. That's the reason the heart rate increases. And beta 2 is the one which is causing vasodilation. And that is the reason tremors, etc., like salbutamol, etc. Now, doc, this child who is being shown to you, right? A spotter है, देखते ही, looking at this lips only, you should be in a position to make a diagnosis. So the BP of this child is 70/40. Now the question is, how do you want to treat this given scenario is an important question. Yes, doc. So keep punching your answers. So Harshit Gowda is proposing adrenaline half ml with 1:1000 solution by intramuscular route. Roshan Yadav also thinks the same. Amrita thinks the same. Satya Snigdha is proposing B. Yes. And Harshit says IM is the correct route. बोल रहा है. Very good. Intramuscular is the route of choice route. Harshit Gowda, absolutely right. Good. Very good. Now, doc, this patient had urethritis. And you found this organism. So looking at the organism, what is your diagnosis? And what is your treatment? A very simple, easy question, doctor. Harshit Gowda, absolutely good. Gonorrhea, Gonorrhea. Yes, Setu Murugan is right about the earlier case that it is anaphylactic shock. Imamuddin Khan is proposing ceftriaxone 250 milligrams. No sir. No sir. Gonococcal or non-gonococcal, irrespective of that, what is the protocol in case of urethritis, doc? Gonococcal or even non-gonococcal? Azithromycin 2 gram oral single dose. Beautiful question, right? हाँ. So कल के एग्जाम में आए तो you are going to remember me. Now, a patient with HIV develops diarrhea, and the fecal examination with the acid fast staining is being shown to you. So you are able to see a cyst. So now the question is, what is this organism? Is the examiner's question. So Pratik Srivastava proposes A. Suraj Srivastava proposes A. अच्छा, हम पूछेंगे Pratik Srivastava, Suraj Srivastava. You both are brothers? Which city are you from, Suraj? And which city, Dr. Pratik? Very good. Now we are becoming All India Radio. Pratik Srivastava, Pratik Srivastava और उनके कजिन के अनुरोध से आपको ये गीत फरमाइश से ये गीत प्रस्तुत कर रहे हैं हम. हाँ, फटाफट बोलो. व्हाट इज योर आंसर, डॉक्टर? क्वेश्चन नंबर 26. प्रतीक जी इज फ्रॉम वाराणसी. गंगा मैया को प्रणाम. सो व्हाट इज योर आंसर? So Kodgram is proposing D, Mycobacterium avium intracellular. अच्छा, ये acid fast staining बोले तो clean board हो गया जनाब. So you should remember it is Isospora bellii is what you need to remember. Now you identify this organism based upon the image. What is this organism? You call this mucor or penicillium or rhizopus or aspergillus. Acute angle दिख रहा है आपको? नहीं तो obtuse angle दिख रहे हैं. क्या दिख रहे हैं? Right. Suraj Srivastava ji, वाराणसी. वाराणसी is in UP, no? हाँ. आगरा वो भी यूपी में है. Very good. So श्रीवास्तव जी नेक्स्ट टाइम ताजमहल देखने के लिए आए तो आपके घर को आएंगे लंच के लिए. हाँ. So Sara Kaderi, Sudha Shukla, they're all proposing acute angle branching of the aspergillus. Absolutely right. Absolutely. Now, a male from Himachal Pradesh presented with a history of a thorn prick a year back has a lesion which is being shown to you, right? And this is the organism which you are able to see, and the cysts of the organism, and it is a dimorphic organism. So what is the agent is a very important question. Question number 28. Sudhaji bol rahe sporotrichosis, Rakhi also, Harita also, Malaji also, and Harshit Gowda is proposing sclerotic bodies. Absolutely. No, doctor. Because of the prick, you thought it as sporotrichosis. Okay. But the point is, this is chromoblastomycosis, doctor. What you are having here? Verrucous lesion. This is a verrucous lesion. Verrucous lesion is a very important clue. And the appearance of this organism is an important clue to call that as chromoblastomycosis. Sudha Shukla, absolutely right. Now, doc, best method of diagnosis of this condition, where patient was receiving antibiotics for past 2 weeks, and he developed, this is a colonoscopic appearance, right? Excellent. Somavarapu Sunandini is rocking with microbiology, Mahagyan. Absolutely right. Medlar or copper penny bodies, you should be very sure. So that is the whole purpose of our classmates. Harshit Gowda made a guess but not a correct guess. It is not melanosis coli, which you typically see in those who are using a lot of laxative abuse. Hai to melanosis coli aayega, Harshit Gowda ji. So, what is your answer for this question? So, question number 29. History dekho और endoscopy देखो और आंसर करो बाबूजी. Sudha Shukla proposes toxin gene directly. Acha. Then Ritu Raj is proposing toxin detection by ELISA. Right. Very good. Toxin detection by ELISA. Oh my God, I can't believe 125 online. Thank you so much for coming to the session. Every day evening, please come and bring all your friends and enjoy the session. आप आ रहे तो हम भी बहुत खुशी से 2 घंटे बैठ के क्वेश्चंस नया क्वेश्चंस बना के राइट आपके साथ डिस्कशन करके आपको फुल एक्टिवेशन मोड में लेके जाएंगे राइट. हाँ, सो every week we used to have a clinico-pathological conference while doing MD General Medicine residency. There used to be one day mortality session, one radiology session. I did my MD General Medicine from Nizam's Institute of Medical Sciences. Those days, you need to be state first or second in order to join the Nizam's Institute of Medical Sciences. So, once more, वो दिनों का याद आ रहे हैं आपके साथ image based questions discuss करते हुए. Very good. So, doc, it is pseudomembranous colitis. The endoscopic appearance is what you should remember. And yes. Now, doctor, you identify this organism from the given image. So, there is an endoflagella and DNA in the nucleoid riboplasm. So, what is your answer? And there is a periplasm, a sub appearance dekhe to, which organism do you think, doc? Question number 13. Question number 13. Yes. So, Bhuvaneshwar, Bhaskar, Pratik, Arsad Musa, everyone thinks it is Leptospira. Excellent. So, one important point you need to remember, doctor, we use crystalline penicillin to treat the Leptospira or any cell wall synthesis inhibitor like ceftriaxone also, right? And Leptospira is a close differential diagnosis for malaria. Malaria may be jaundice hota. Malaria also will lead to renal failure, and Leptospira also jaundice, renal failure. Typically, a patient from a rural background is a classical, a farmer by occupation. So that is the reason we are an agrarian society with a lot of farming community. So this kind of common conditions we should be in a position to discover. Somavarapu Sunandini is our Professor Sunandini. Always keep adding some new points. Suddenly aapko yaad aa gaya to keep typing, right? So live classes, live face-to-face classes होते हैं ना डॉक्टर, वहाँ कुछ भी बात करने का नहीं होता. यहाँ तो कुछ भी चाहिए आप बात कर सकते. You can be able to enter and text it. That is the advantage of a live online interactive. So you should remember Leptospira. Now, based on the image, microscopic appearance, what is this organism that you are able to see? Right? So this is one important classical question. Yes. Satya Snigdha Tripathi, always right. Arsad, clean bowl. Sudha, clean bowl. Roshan is right. That is Mycobacterium is what you should remember. Now, a fecal smear had been taken. You identify what is this organism. On the fecal smear, fecal smear, what is the organism. माइक्रोबायोलॉजी दिनों में हम हॉट लव स्टोरी चलता है मेडिकल कॉलेज में. फर्स्ट ईयर बहुत सीरियस रहते, फाइनल ईयर में तो टेंशन रहते, एग्जाम बोल के. The period where most of the medical students, 80%, we are either dumped or we will dump somebody. So that is the phase. जब micropharma, pathoforensic, why are they the most troublesome subjects for many people? That is the time we are in our romantic heights. We need to be also. Otherwise, what story you will tell to your grandchildren if you don't have one? And that one story happens typically in the second year of MBBS. So, doctor, exit exam is to identify how strong you are romantic in your second year, right? So, Ravi is proposing Giardia lamblia. Oh, Sharmista is proposing Belantidium. Gesmaro. So, Akib Syed is proposing Giardia lamblia. Jahin Ilyas, Giardia lamblia. Oh, so doctor, you should remember, it is Belantidium coli is what you need to remember, right? Now, you identify this organism based on the appearance, on the stool microscopy. So today, agar jada clean bold ho gaya to, lot of questions. Go back to the onlinembbs.com in the microbiology. In the microbiology, these are all the high yield topics. There's one topic called discovering X and cis in the stool. Very high yield topic. You have to go back and do the review, right? So, Mala Krishna is proposing Giardia lamblia. Arsad is also thinking the same very strongly. Vishalakshi also. Excellent doctor, right? So, it is very much Giardia lamblia. And similarly, what are those cysts that float in the saturated sodium chloride solution which will sink into it? Their floating and sinking will decide our life, floating and sinking in PG medical entrance. Right, doc? Yes. Good to see Saurabh LTD. Excellent. And Jayesh, a lot of new students. Doctor, each of you are there in the WhatsApp group of your classmates, right? So, if you really liked this program, please don't forget to post the link of our YouTube channel and tell your classmates. Imagine you are 120 audience live now into 150 classmates. 18,000 students will come to know that we have a everyday evening program happening. That's more than enough that our super 1000 PG medical entrance का super 1000 batch ready हो जाएगा, and I will call Bollywood guys to start to take a movie on me, right? High time, doctor, right? Very good. So Suraj Srivastav, Jahin Ilyas, everyone is proposing arsenic. Absolutely right, right? Arsenic. So it is also called black foot disease. What is this called? Black foot disease. In some communities, in the drinking water, when the arsenic levels happen to increase, yes, very good. Harshit Gowda is our major crowd puller. Excellent. Thank you, Harshit. So, question number 34, black foot disease. Excellent. So, you need to remember that there is a severe peripheral vascular disease that develops if the arsenic poisoning is there. That lead to progressive gangrene, which is typically called the black foot disease, is what you need to remember. Now, a middle-aged lady presented to the OPD with painful blisters on the skin and the oral mucosa. The direct immunofluorescence was done. And what is true about her pathogenesis? एक बार you have to basically look at the appearance. Yes. Now, shoot your answer, doctor. Harshit Gowda is proposing lichen planus. Lichen planus. Right. Now, yeah. Very good. Question number 35. Jahin Ilyas is proposing A, and yeah. So I'm trying to remove the Sauda from this chat because he's misusing the situation. Yeah. All right. Now the question is a middle-aged lady. So what is your answer, doctor? Is it Pemphigus vulgaris? Absolutely right, doctor. Absolutely right. So it is IgG against hemidesmosomes. Now, doctor, time aa gaya where we have to become a champion on this topic. Mainly Pemphigus. Let me take a blue colored pen. Yes. Pen color will be blue. Okay. Now, young patients, they are the ones which are affected in Pemphigus vulgaris. Mucosal involvement, where the oral lesions are seen, is a feature of vulgaris. Antibodies against desmoglein 3, which is desmosome, is Pemphigus vulgaris, whereas antibodies against hemidesmosome is bullous pemphigoid. Then intraepidermal blisters is the feature of Pemphigus vulgaris, whereas subepidermal hota hai bullous pemphigoid. You have to be emphatically sure to answer this. Remember this slide, doctor. So this slide is there in every book. Every book में रहना अलग है, हमारे दिमाग के दिल के अंदर जो किताब रहता है उसके अंदर नोटिफाई होना मोस्ट इंपॉर्टेंट है. Blisters are flaccid. Oh hey, Pemphigus vulgaris. Blisters are tense and firm in case of bullous. Nikolsky's sign is positive in Pemphigus vulgaris. Acantholysis is typically a feature of Pemphigus vulgaris. Immunofluorescence shows net-like immunoglobulin G. Whereas bullous pemphigoid में क्या रहता? Linear IgG is the feature of bullous pemphigoid. Most patients die if you don't treat, if it is Pemphigus vulgaris, but prognosis is good in bullous pemphigoid. Tombstone appearance, please don't forget, doctor, tombstone appearance is a very, very important feature in Pemphigus vulgaris, whereas bullous pemphigoid, there's a eosinophilic infiltration which is being seen. So these are the points you need to understand. So once more, summarize karo. Acantholysis, presence of neutrophils, eosinophils and acantholytic cells, erosions and ulceration, spongiosis histologically, and a fishnet pattern of immunofluorescence of IgG and intraepidermal acantholytic blister. These are the things you have to be 100% sure, doctor. Right? Then bullous pemphigoid. Fatafat bolo. Typically, there is a eosinophilic spongiosis, then perivascular lymphocytes, dermoepidermal junction, there is a vacuolar change, and there are basal cells and infiltrated with eosinophils and neutrophils. And typically, it is a subepidermal blister formation. That is the point of interest. Then another important thing you should know. Elderly people में bullous pemphigoid होता, but prognosis of bullous pemphigoid is good, but Pemphigus vulgaris is not good. So that is a thing. Young people affect hota, but poor prognosis. Elderly people, but good prognosis. That is a fundamental story. So treatment of bullous pemphigoid is oral steroids, and Pemphigus vulgaris may you have to give steroids, but also the other things like um, the azathioprine and cyclophosphamide and other forms of immunosuppression is what you need to remember. Now, once more, this is also an important thing that you need to know. Tense fluid filled blisters is an important feature. So Ranjit Shah, can we see the questions again, sir? You can. We will keep the quiz part in the preserve, and we will try to remove only the regular class part, right? So, but all these things we discussed with Doctor. Many times we discussed and made available in the video library. PGI, AIMS, JIPMA, All India, in सबका question bank. Nearly 30,000 MCQs we have discussed and made available, right? So आपको जितना energy है उतना revision कर सकते हैं onlinembbs.com video library में. So please feel free. You have a lot of mock tests, almost 200 full-scale grant tests, along with the discussion, along with the PowerPoints. 50,000 MCQs are available with explanations in the onlinembbs.com video library. So that is the reason. These live sessions are mainly to activate you. However, we have everything available everywhere around us. We need to get that energy to wake up and study and invest 5 to 6 hours of time every day, right? So, Doc, let's quickly go to the next question. A histopathological image of the skin biopsy of the patient is being given below. Skin biopsy of the patient is given below. What is it suggestive of? Sesha Gopalan is asking, how can you be so energetic, sir? Bornavita, right? See, Doc. 100 great guys like you are coming means 120 doctors like you are giving your time to listen me. That is the secret of my energy. You guys are all secret of my energy, right? So, every day somebody will be, or some other student will be calling and saying, sir, today I have seen this case. Sir, today I have seen this challenging case. And I remembered 5 years back what we discussed in the class. Same thing, my first case of amyotrophic lateral sclerosis. Just day before yesterday, one of the students called. He's a general medicine guy from PGI. He said, sir, my first case of amyotrophic lateral sclerosis dekha. I only remembered every word of you, sir, whatever you said. So it is a kick for me. It's a new kick for me. So that is the thing, doctor. Yes. So, very good. So you should remember, it is Pemphigus vulgaris is the thing that you need to basically remember. It is that acantholysis and Nikolsky sign, that is what you are, the acantholysis is what you are able to see, is what you need to remember, right? Now, a young female presented with vaginal itching and a green frothy genital discharge, and this is the physical examination finding. So isko dekhe to what you are able to remember, accordingly what is your diagnosis and what is your treatment is a very, very important question. Yes. Should your answer, doctor? Yes. So excellent. Sam Singh is proposing single dose fluconazole. Oh, you think it is candida? And Padmanabha proposes strawberry cervix. Badhiya. And Manoj Shinde is proposing metronidazole. Excellent, doctor. Excellent. Metronidazole is the absolutely right answer. So, पहला स्ट्रॉबेरी कभी देखा क्या? स्ट्रॉबेरी देखे तो आपको स्ट्रॉबेरी वेजाइना कैसे दिखता? See, fundamentally, these punctate hemorrhages are there, no doctor. These punctate hemorrhages basically give that appearance of strawberry, right? So, Strawberry vagina typically is seen in, so there are a lot of strawberries in the entire general medicine. You have to be 100% sure what are all the places wherever the strawberries are seen. Strawberry tongue जो होता है, strawberry tongue, Kawasaki disease you should remember. Similarly, strawberry gingiva. So whatever the gingiva you are seeing, strawberry gingiva is a feature in vaginous granulomatosis. Strawberry nose. Where do you see nose? It is rhinosporidiasis. And also in infantile hemangioma of the nose also. Infantile hemangioma of the nose also. You see the proliferative, in its proliferative phase, strawberry nose is what you need to remember. Sara Kaderi rightly says, treat the partner also is an important point we should always remember, right? The patient presented with scaly plaques on the head with itching and mild discharge, hair loss. What investigation do you want to do is a very, very important question of the examiner. So, Sudha, Satya, Harshit Gowda, everyone is saying KOH mount. Absolutely right. Now, a young girl presented to the OPD with the patchy hair loss for 2 weeks, as shown. She did not fight with her boyfriend. So, now the question comes. There is no scarring or there is no scarring and no erythema. That's a very, very important clue. So what is the likely cause in this given, most likely cause in this given case? Absolutely. Chandrakant rightly says trichotillomania. Some children, when they become tense and anxious, they pull out the hair, which is called trichotillomania. So Vibhaji clean bowl, Chandra clean bowl, and Vibha and Chandra should go back to review the psychiatry. It's a very standard question. If actual exam में wrong करे तो we will go behind by few ranks. So you have to be very sure about, right? So a 12-year-old boy is complaining of 4 lesions like this. 4 lesions like this. Now the question is, he also lost sensation. Then what is the treatment in this given case? Right. So should you answer, doctor? Question number 40. Yeah. So 12-year-old boy, 4 lesions like this. Patchy loss of sensation. So what is the treatment of this case? Yeah. Should you answer? Yes. So Chandrakant Haidar is proposing B. Only rifampicin and dapsone. Why? Samsung is proposing D. Okay. Arshad Musa is saying C. Satya is proposing A. So Harshit Gowda and Arshad Musa, absolutely right. You have to give CDR, rifampicin 600, dapsone 150, dapsone 50, rifampicin 450, clofazimine 150 mg monthly and 50 mg alternate days is considered to be the management of choice. Now, doc, this is a congenital lesion. Preoperatively, this is the picture. Congenital lesion. So now the question comes, what is the lesion that you are able to see here? Good to see Nanda Kumar Neharkar, late but latest answers we want from Nandu. Fadafat bolo Nanda, what is your answer? Question number 41. There are 4 lesions, Ranjit ji, in the earlier question, right? So, Rizwana Ali is proposing melanocytic nevus. Chandrakant is thinking epidermal verrucous nevi. Okay, good. So, it is congenital melanocytic nevus. Now, doc. A 11-year-old presented with itchy hyper pigmented plaques in the cubital and popliteal fossa, right? Now, yeah. So in the popliteal fossa, you are able to see these itchy lesions. So what is your diagnosis? Very easy question. Question number 42. Chandrakant Haidar is proposing A. Rizwana Ali says A. Vishalakshi says A. Badhiya. So it is atopic dermatitis, doctor. Absolutely right. Now you are seeing a needle. Fundamentally a needle. A needle भी नहीं देखे तो हमारे housemanship अनर्थ है. Right? So be very sure, doc. Question number 43. Suraj Srivastav is saying A. Very good. Harshit rightly says LP needle. Right. LP needle. Surgeon Harshit is ready to operate. Who is going to put anesthesia? Ranjit Shaw proposes A. Padmanabha also thinks A. Right? No, sir. ब्रेथ होल्डिंग क्यों करते हैं आप? लंबर पंक्चर नीडल लगाते वक्त ब्रेथ होल्डिंग पूछते क्या? द बेवल ऑफ द नीडल नीड टू फेस अपवर्ड्स. लेटरल रिकम्बेंट पोजीशन में करते हैं. कोयागुलोपैथी है तो एब्सोल्यूट कॉन्ट्राइंडिकेशन होता है. कोयागुलोपैथी पेशेंट को भी लंबार पंक्चर नीडल लगाए तो कोयागुलोपैथी जाएगा तिरुपति. सो बी वेरी श्योर अबाउट इट. राइट? हाँ. नाउ a complex renal cyst was incidentally detected on ultrasound in a patient who underwent a CT for an insurance workup. So what is the most likely diagnosis of this case? Based upon the appearance, आप diagnose करना है. Based on the appearance. Let me check how many of you are inborn error of radiology है आपके अंदर. So Roshan thinks B. Right. Harshit Gowda thinks oncocytoma. Arsad Musa thinks perinephric cyst. देखो. Sudha Shukla thinks renal cell carcinoma. Right. Little difficult question. Even radiology guys have to sit and debate and discuss about this lesion. Good, good. Somavarapu Sunandini MD radiology का seat ले रहा है. So typically angiomyolipoma में lot of adipose tissue रहता है. So this is the typical contrast enhanced CT where you are able to see the angiomyolipoma of the kidney. Very good. Now, doc, 65-year-old male banker came for an ultrasound और एक किडनी वाला क्वेश्चन. आज पूरा किडनी मासेस का एक्सपर्ट हो जाएंगे. The picture of the CT scan is being shown. So, what is this most likely to be? Question number 45. Yes. 65-year-old male banker. When you have done the investigation, you found this. So, what is it most likely to be? Abhi, you are right. Sudha and time of life and Sara Kaderi Vismay Panchal, everyone is right, it is renal cell carcinoma is what you need to remember. Now doctor, a young female with a history of renal calculi complains of bone pain, abdominal cramps. Now you are able to see her radiographs, right? So there is a lesion here. अच्छा भाई, there is a lesion here. दिल लगा के देखो, देखने के बाद आंसर करो. Her serum, calcium and PTH are raised. Then what are these lesions seen in the radiograph called? And what is the next investigation you want to do? Is a very important question, right? So Sunandini, absolutely superb. Sunandini, I am proud of you. Excellent. Now, parathyroid, they are brown tumors. Absolutely, as told by Sunandini. So, brown tumors. Sara Kaderi rightly says it is Sastamibi scan for the parathyroid adenoma you have to basically do in this case. Now, a patient with pain abdomen for 2 hours presents to the casualty. Pain abdomen for 2 hours presents to casualty. अच्छा, आप एक्सरे दिल लगा के देख लो, right? So if I am coming in middle, I will try to move out, right? आप एक्सरे को अच्छे दिल लगा के देखो, देख लिया ना? So looking at that X-ray, you have to be very sure, right? So now you tell me, doctor, what is the most likely diagnosis? Question number 47. Yes. Question number 47. Arsad Musa Klee proposes pneumoperitoneum. Okay. Harshit Gowda recognized rightly that there is a air under diaphragm. Diaphragm के नीचे air है, इसलिए translucency है. So Chandrakant Haider is proposing pneumoperitoneum. Ravi says amoebic liver abscess. अच्छा, मगर amoebic liver abscess रहते ये पूरा opaque रहता है ना बेटा. Hemidiaphragm elevate होता है right side में, मगर Ravi, you have to be sure that there will be no lucency. That's the point. Yeah. Should your answer, doctor? Very good. It is pneumoperitoneum is what you need to remember. Now a chest X-ray is being shown below, right? And look at the chest X-ray very clearly, right? It should give you the idea. So chest X-ray dekh liya na? Now tell me, what are the features? What is the feature that you are not seeing in this chest X-ray? What is the feature you are not seeing in the chest X-ray? Is a very important question. Yes. So, are you able to see a narrow vascular pedicle? Yes, sir. There is a narrow vascular pedicle. The time of life is saying D. Right. Vismay Panchal says there is no pulmonary venous hypertension. Padmanabha is saying A. So there is a decreased pulmonary flow. Pulmonary oligemia hai. And there is a right atrial enlargement. Always the right atrial enlargement, left atrium enlarges and lead to shadow within the shadow appearance. Mitral stenosis may, this is right atrial enlargement, right? So you are unable to see pulmonary venous hypertension. Pulmonary venous hypertension hai to a sub will be having that vascularity, which is not the case here. So Akash, Uttam, etc. are absolutely right. Very good. Now doc, you need to remember pulmonary artery hypertension में what are the classical features? Pulmonary artery hypertension में prominent central pulmonary artery रहता, peripherally hypovascularity रहता, and right descending pulmonary artery become very prominent, and there will be a right ventricular enlargement. Always right ventricle is more anterior. So substernally under the sternum, if there is a filling of the heart, that is because of the right ventricle. So right ventricular enlargement is a feature which you see in case of the pulmonary hypertension is what you should remember. Now doctor, this pointed area in the jugular venous pulse, what is it because of? Question number 49. So this part of the wave, what is that called? And what does it basically represent? Easy question actually. That's right. Jyoti Achutani is absolutely right. Right atrial contraction. Vismay Panchal also is saying right atrial contraction. So if there is an atrial fibrillation, typically this A wave will be absent is what you have to ultimately remember. Now doc, a spirometry has been done. You calculate the FVC value. Only one thing. FVC kitna hai in this. You have to give an answer. FVC value kitna hai? Yeah. Should you answer, doc? Yeah. Anurag Chaudhary, welcome. Late but latest, no worries. But please give an answer, Anurag. Anurag is saying 5,000. 5,000. Okay. And Jyoti says C, 1,200. Okay. Then Manoj Shinde, Jindabad. Arsad Musa, Jindabad. Rizwana Ali, Jindabad. Navya Teja, Jindabad. So you should remember, doctor, that what is FVC? Right? So FVC कैसा आता है बोले तो आपका total lung capacity से residual volume को minus करो. Total lung capacity से residual volume को minus करना. So ये कितना है total lung capacity? 5,000. Total lung capacity is 5,000. उसमें से residual volume is 1,300. So minus 1,300. वो हो गया 3,700, which is typically the FVC value. Now, this following reflex, which is being shown to you, what is this mediated by? इस reflex को क्या reflex कहते हैं? Or it is mediated by what? Is a very important question. So whenever there is a venous pooling, it leads to sympathetic activation that leads to vigorous contraction of a poorly filled ventricle, and that stimulates the C fibers, and the brainstem in turn will cause vagal efferents to get stimulated that lead to bradycardia and also hypotension. Now the question comes, this reflex is mediated by what? Yes. Question number 51. Who is going to give me the correct answer? Chandrakant is saying Bain bridge reflex. Arsad Musa, bejeweled reflex with the serotonin. Excellent. And Arga Saha is proposing serotonin. It is a bejeweled Jarisk reflex, right? Bejeweled Jarisk reflex. Arsad Musa, man of the match in physiology, right? Man of the match. Excellent. I thought very few will answer, and you have correctly answered. Very happy about it. So, Now doctor, two vessels are compared here, and one is having twice the length, twice is the diameter. So now what will be the flow in this vessel 1 compared to the top of the vessel 2 is the important question. So who is going to give me the correct answer? Yes. Vessel 2 compared to vessel 2. Question number 52. Fatafat answer karo. Yes. So Mala Krishna is proposing 16 times. Arshad Musa says 8 times. Ranjit Singh, Ravi Kamble are also saying 8 times. अच्छा, इसका फंडा क्या है देखेंगे. So, if you look at the flow doctor, flow is inversely proportional to resistance. Resistance is directly proportional to length and inversely proportional to the fourth power of the radius. So automatically flow is typically proportional to fourth power of the radius divided by L. क्यों? Flow is proportional to 1 by R, but R is L by R to the power of 4. So flow is proportional to R to the power of 4 by length. अभी इसमें क्या हो गया? The radius is half. I mean radius is double. So 2 into 2 into 2 into 2. So 2 to the power of 4 divided by length also is double. So 2. So 2 cancel हो गया. 2 2s are 4, 4 2s are 8 हो गया answer. So 8 times is what you need to remember. Right doc? हाँ. No, but the point is यहाँ length भी consider करना है ना. So अगर length same है तो आपका 16 is okay. But length 2L है, यहाँ L है. So that's the reason divided by 2. That becomes 8 times. Right? So that's what you need to understand. Now doc, identify the accessory protein which is marked in this diagram. Should your answer doctor? Very good. आज 21 thumbs up आ गया. Right. So give me one confident answer. Question number 53. Identify the protein in this marked area में रहने वाला protein क्या होता है? Question number 53. Manoj Shinde. Absolutely right. Manoj Shinde is proposing actinin. Ravi Kamble is saying titin. Good. So it is actinin, doctor. So you should be quite sure on this structure. So you have the actin filaments, and this is the Z disc. You have the C zone. This is the M band, and you have the myosin, and here you have the titin. So these are the things you have to be very sure about. Now doc, the following radiograph which is being shown here, right? So दिल लगा के देखो, transport maximum value is being given as 150 milligram per minute. That is one thing you should understand. So what is transport maximum? Transport maximum is that value of the filtered load of the glucose into the through the glomerulus into the tubule. Filtered load per minute. If the amount of glucose is filtered more than 150 milligram in this case, because tubular maximum is 150. Above 150 is all excreted into the urine. Abhi answer karo, fadafat. So the patient's blood sugar is 200 and the glomerular filtration is 90. So in this given context, what will be the urinary glucose? इसका सही जवाब जो देता है, he is the man of the match for the physiology for the today's evening. Yeah. Should your answer, doctor? Man of the match or women of the match? Whatever. Yeah. Give me a confident answer. So, renal tubular transport maxima is being given. Yes, very good. So, I can see Anurag, Roshan, Sudha, everyone is proposing 30 milligram per minute. Absolutely right. So, 200 milligram per deciliter is the blood sugar. And how many deciliter make the milliliter? That you need to be very sure, doctor. 1 deciliter is 100 ml. 1 deciliter is 100 ml. So 200 milligrams of per deciliter, no? 200 milligrams per 100 ml is there. So 90 ml में of the blood में कितना होता? 90 ml में 180 रहता. So 180 milligrams is being filtered per minute into the tubule, and 150 milligram per minute तक tubular maximum है. So 180 minus 150 क्या हो गया? 30 हो गया. So that brings us to the end of the today's evening, doctor. Thanks for a patient hearing. Tomorrow we will finish the बायोकेमिस्ट्री, लास्ट 30 क्वेश्चंस है, एंड कल हम एक बढ़िया शुरुआत करेंगे एनाटॉमी. सो वी ऑलरेडी फिनिश्ड, एज आई टोल्ड यू, द एम्स, पीजीआई, जिपमर, एवरीथिंग. The question banks topic wise are discussed, debated, PowerPoints and videos are uploaded into onlinemmbbs.com. So these questions are all the whatever that we are discussing in the evenings are asked in the PG MDS entrance exam in the last 15 years. But these questions are worth because there's a common question bank for both of them. So please don't forget, each of you have 150 classmates in your WhatsApp group of the classmates. Your juniors are another 150. So 300 को आप share करना. So 300 into my tubular transport maximum का calculation बोल रहा हूँ. 300 into 120, 36,000 students must know that every day evening we are having a live free class on the YouTube, and we will have a great, wonderful evening preparation. Until you get the seat in NEET PG, you have Dr. Murali Bharadwaj with you. So that is my promise to all of you. Good night and enjoy a great preparation. Thank you.